We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Welcome to the Healthcare Revolution podcast. Today we are talking about myths behind shoulder pain. If you have shoulder pain, this is the podcast for you, because we're talking about all the things that you should know to be able to get your shoulder pain better. There's been a lot of good research that's recently been published in the last 5 years that'll really help you understand why you have shoulder pain, especially if you don't have shoulder pain because of a specific injury. If you just develop shoulder pain over time, I promise you, as you listen to these steps, it'll help you, empower you to know what to do and to know the steps to be able to get out of your pain, or if you need to, see a physical therapist or any other provider to help you get to the life that you always wanted. So welcome to the podcast. Today I have here with me Lauren, who's going to facilitate questions and give us the questions that you have so we can answer those questions for you.
Our first myth is, if my MRI shows a tear, I need surgery.
That is such a great question, because so many people think that MRI is the gold standard, the gold standard, meaning like that is what I need to do. I have a tear, therefore I need to get surgery. There's a lot to unpack there. Essentially, if I took an MRI of 1,000 people, around 70-80%, depending on the age, around 60 years old, 70% of those people would have a tear, and most of them wouldn't have shoulder pain at all. What you see on an MRI doesn't always correlate with your symptoms. So if you have shoulder pain and you have a great provider that's guiding you through that care, and you decide to get an MRI and the tear is associated with your pain, and you've done all the things to get rid of that pain through physical therapy, injections, all the different things that you can do for shoulder pain, and you're still not getting better, then that MRI may be really helpful. But if you just decide, I'm going to get an MRI just because I want to know what's going on with my shoulder, you're going to get 5 to 6 things on that MRI that can be mentally debilitating and psychologically negative for your brain to be able to see, and they actually don't matter. They're just white noise, because most people have those things. Most people have degenerative change. Degenerative change just means you're getting older. It's very harmful language. It's not intended to be that way. Most MRI interpretations were coming from a radiologist to go back to the physician. The physician's job, or the provider that ordered the imaging, is there to interpret that for the patient. The radiologist was never intended to be able to get that information to the patient, because the way they interpret it can be very harmful for how the patient sees it. Patients, as they see their MRI, it actually makes their pain increase by 3 points on the 0 to 10 scale. And it's really interesting psychologically how that negatively impacts you. If you see your MRI, you associate that is the reason why I hurt. Now, therefore, you hurt more. So the intention in the first place of the radiologist was to give the interpretation to the provider, and then the provider interprets it for the patient. The problem is it's uploaded to the patient portal, which then the patient has time to review it on their own, make their own interpretations, Google it, ChatGPT it, and then all of a sudden their shoulder's falling apart and they need surgery tomorrow, when that might not be the case. It's super important that you get a medical professional to interpret your MRI, not just read the findings, because the findings, again, were for the person that's able to interpret it. A lot of society doesn't know all that medical jargon, and even if you Google it, it's not going to be that helpful for you. But it's important that we marry the physical exam and your symptoms with the MRI. And if they are married, then we can make good clinical decision making on what to do next.
Our next one is, rest and ice are the best way to heal my shoulder.
Rest and ice is actually one of the worst recommendations ever provided. Much love to the doctor that coined the term rest. Rest stands for rest, ice, compression, elevation. He came out, I believe it was around 10 years ago, and said, I was completely wrong. Like, we shouldn't be resting any injury. There's literally no injury you should rest. Compression ice is another thing. That's a whole nother topic. But resting is literally the worst thing you could do for most injuries. Immobilization is a different story. If you have a broken bone, we put it in a cast because the bone actually needs to stay still to be able to heal and do its processes to get strong again. If you sprain your ankle, protection is what you should be doing. Movement, gradual movement is what you should be doing. So we call it optimal loading. So optimal loading is going to be different for every injury. Did you injure a tendon? Did you injure a joint? Did you injure a capsule? Did you injure a muscle? Each one of those has different parameters of what optimal loading looks like. Almost all of the time, movement is the best medicine in certain ranges. Sometimes with certain tissue, we want to push into pain. The majority of the time, we actually push to the pain, but not into the pain. But each different tissue has different parameters of how much optimal loading that we actually push into it. And that's why you need a professional guide to say, okay, this is a tendon. This tendon has had overuse injury. We actually work into like a 2 to 3 out of 10 pain when we challenge that tissue for it to improve. If you sprained your ankle, we actually push to the pain. We have you do use the motion to the pain, but we don't work into pain. So each one's a little bit different. It's important you have a good professional guide to know when and how and just how much tension, how much load to add into that tissue to create optimal healing. Ice, we typically use for 24 to 48 hours. The goal there, you sprain your ankle, some of the vessels actually tear and cause internal bleeding or bruising. And the idea is to vasoconstrict with the vessels, which means get smaller, to limit fluid getting to the tissue. The problem is if you chronically use ice and you keep using ice, the fluid isn't able to get out because the vessels are smaller. Right? So we don't want to chronically use ice because we want fluid going out as well. And it actually vasoconstricts, so limits blood flow to the tissue that you're trying to heal. We actually want more blood flow after the 48 hours because you need nutrients to the tissue to be able to improve it. So ice, chronically using ice, or even ice after 48 hours, unless it's for pain, actually limits the healing process. It slows it down. We want to improve the healing process, improving the mechanisms of healing, not limiting them. Now, it's important you remember ice has another component that we do like to use it for, and that's pain modulation. It pretty much means like the nerve signal going from the nerve to the brain is giving a heightened signal. So we slow down nerve conduction, we slow down that signal with ice. So if you're in a lot of pain, ice is a good mechanism because pain will limit your ability to get better more than your mechanism of slowing blood flow. So it's important you know how and when to use ice, but that would be some key components to remember.
Shoulder pain means something is torn or broken.
This study that recently came out, I did a presentation for, came out and said that if you're in a sitting job for more than 4 hours a day, you're 3.4 times more likely to have shoulder pain. So why is that? You didn't damage any tissue, but all of a sudden you have shoulder pain and you didn't even do anything to it. And a lot of people think like, oh, I don't understand why I had pain. Maybe I did something back in my 20s or I dropped out that one time. And no, you have shoulder pain because the mechanics of your shoulder have completely changed. There's certain muscles that get weaker in the back of your shoulder. The ball and the socket have to stay in congruency with each other. The ratio between the ball and the socket is similar to a golf ball and a tee. So the tee is literally 1/3 of the size, or actually 1/4 of the size of the ball, right? Which allows for a ton of range of motion in your shoulder. It's the most complex joint in your entire body because of how much excessive range it has. The issue is it has to stay centered on the socket. So if you have certain muscles that are really tight because all I do is work all day and my shoulders are all rounded and I'm hunched over and I'm in the exact same position, then your chest muscles become very shortened and tight, which takes the ball and it shoves it forward in the socket and starts causing compression on certain rotator cuff muscles. It shortens the space in which they operate, and then you go reach overhead and it compresses them, and you do that repetitively and it creates shoulder pain. Right? And then muscles on the back side of the shoulder, we live in a big pushing world. And the way they program exercise, we're doing a lot of pushing and not a lot of pulling. Right? Most exercise plans should have 1 push to every 2 to 3 pulls. But we're doing 3 pushes to every maybe 1 pull. And what I mean by pushes and pulls, I mean bench pressing, push-ups, right? We're doing a lot of pushing, burpees. You think about how much pushing you do in a workout, how much pulling, how many rows am I doing? How many Ys, how many Ts, right? How am I getting those scapular motions, the shoulder blade motions to stabilize the shoulder blade? Because in order for the mechanics of the shoulder to work really well, the shoulder blade has to stay stable for the ball to push off of it, because the shoulder blade is a moving object on a moving object. So it becomes very complex. So if the shoulder blade doesn't stay stable, it's like walking in sand. And you go to push off and it takes a lot of energy, right? And the ball doesn't stay centered on the socket. So if the shoulder mechanics in the scapula are not working really well, then the ball doesn't stay centered on the socket and it just pushes on different structures and it causes shoulder pain. So a lot of people think like, oh my gosh, I got a shoulder rotator cuff tear, or torn my labrum, or, I did all these things. Ultimately, you just need better balance. It's just like a car tire. The car tire might be perfect, but you're riding down the road and it's a little lopsided, and you just go to the tire mechanic and they put little weights on and it balances the tire out and it runs perfect, right? It's a beautiful tire. You have a beautiful shoulder, perfect shoulder, but you just need it a little more balanced, right? It might be your lats are too tight, your pecs are too tight. They might be too weak. There's certain muscles that are suboptimal, or you're compensating. So we figure out all those mechanics, we put them together, and your shoulder works great. We need tune-ups every once in a while.
Our next one is I just need to stretch it more.
So a lot of people think that stretching is solving the answer. Most of the time, things feel tight because they're actually weak, because the body's trying to stabilize, or you've taught it to stay tight, right? So if I'm always in a seated position, my hamstrings will actually tighten over time. Say I spend 10 hours a day sitting, but then I go stand up and go to touch my toes and it feels really tight. It's because I've taught them to stay in a shortened position, right? Now, dancers that are always touching their toes are very, very flexible because they're always utilizing that motion, right? So there's the component of you're teaching it to do that thing, because your body is adaptable. It's a machine, and you get to choose what you want it to do, but it's only programmed based off of what you program it. So if you teach it to be tight by always sitting in positions that are tightening it or shortening it, then it's going to shorten, right? But then there's the second component is my hips always feel tight. Why do they feel tight when I run? It's most likely because there's little muscles in there that are not stabilizing well. So those specific muscles that are not stabilizing well, are not strong enough to be able to do the activity that you need them to do, they are tightening up because they're trying to stabilize. They're trying to hold things still because they don't have the capacity to hold things still. So then they stay turned on all the time. So it's super important you know what's the difference, and having someone help you through that process, say, why am I tight? Because there's different reasons for feeling tight.
Good posture will fix my shoulder pain.
That's the biggest lie, and it goes back to our podcast on, that's the biggest myth. The best posture is your next posture. Like your body's meant to move. It's not meant to stay in the same spot all the time. It's meant to move, and sure, the same position all day long, the same posture all day long will influence shoulder pain, right? Based on that study with sitting more than 4 hours, you're 4 times more likely to have shoulder pain. And the best posture is really just moving throughout the day and teaching your body how to get into different positions and not staying in the same position. If you were doing an audit of your day, someone was just to look at you, how many hours are you spending in that exact same position? That's the bad posture if you're spending a ton of time there. And that does influence shoulder pain. So how can you switch it up? But you can develop shoulder pain just by sitting upright all day long in a perfect posture, right? But the goal is to switch it up throughout the day.
My next one, and I think I've said this probably 20 times myself. My shoulder hurts because I slept wrong.
Your shoulder can hurt from sleeping wrong sometimes, right? So if you have, ultimately in a sleeping position, you want to be in the most neutral position possible, right? Because it requires the least amount of strain on all of your structures, right? So ultimately, if I'm laying on my side and I have a pillow between my shoulder and my head, it fills the gap. So my head's not tilted to the right, my head's not tilted to the left. Because you you can compress things for too long. You could fall asleep with your arm behind your head wrapped around. Like, we've all woken up sometimes and like our arms are completely lost blood flow, right? So you can do things in your sleep when you're unconscious that can cause damage, that hurts things, right? But most of the time, if you actually injure your shoulder from sleep, you actually already had compounding issues before, that your body has learned to compensate, and you've neglected certain things for a certain period of time, caused this imbalance, and sleeping just happened to be the last straw. It's not that you literally physically injured your shoulder when you were sleeping, although that can happen, right? Depends on how unconscious you are and if you're sleepwalking, doing all these weird things, right? But ultimately, what you need to think about is what we're doing causing the shoulder pain, or is it the multiple things that have happened along the way that have led to this issue?
Once you have shoulder pain, it never really goes away.
Once you have shoulder pain, it can always go away. And I shouldn't say always, but the majority of the time, you just need some corrective exercises. You need a tune-up, just like your car. We all maintain our cars through oil changes and tire balancing and certain things that we need to do. It's like any machine, an HVAC system, a heater, a cooler, right? You have to do certain things to your body. Input always influences output. If you're not regularly exercising, regularly having balance or nutrition or sleep, it's going to positively or negatively impact your overall health and how you feel. So it's just important that we're doing the regular things that don't lead to those things. If you have shoulder pain, do the things that you know to improve it. If it doesn't improve, find someone that can help you, because shoulder pain is not something that you should have to deal with your entire life. And if you've worked with a provider and they've told you that's just part of aging, find a new provider, because I believe that people can live the life they always wanted without pain. The only caveat to that is if you've put yourself through some significant physical trauma. My motocross racers, they're notorious for that. Like, you've literally obliterated your hip, shattered it into 15 places, and now we've screwed it all together. There's some instances that pain may be a long-term thing, but the majority of the time, anyone can get out of pain.
What would you suggest as somebody's first step to get out of pain?
My first step is to apply these principles that we talked about today. Change your belief system. Try some of these corrective exercises. You can YouTube some things. If you don't get to where you need to with those resources, then go find a professional that can help you, whether it be a physician or a physical therapist. I believe that physical therapy should be the entry point to everything injury and pain. We are the most skilled providers in this area, and they can help you the most. And if they can't help you, they should lead you to someone that could. Right? But start with your physical therapist. If you can't solve it on your own with these principles, go to a PT that can help guide you through the process and lead you through those steps to be able to get you back to the life you always wanted. But I hope these tips are helpful in thinking about shoulder pain, and that they can help you get out of that nagging shoulder pain and that mindset of I'm going to be in pain forever, because it's not true. You can get out of shoulder pain, and it's super. If you know the principles, it's simple. It's just like maintaining your car. So I hope these principles have helped. Thanks for joining us today.